for our little chat about endometriosis and infertility. My name is Tara LetsGetHealthy123Go. I'm a certified iridologist and herbalist and a mother of 7. And with me this evening is Dr. Mary Reed Gates, who is a traditional naturopath, and she's got a whole bunch of other fancy little titles there. And I had endometriosis once, and I was told that I would never have children. And as you can see, I have 7. And it's a condition where the lining of the uterus sometimes gets misplaced or displaced and doesn't go where it should. And it can cause all sorts of pain and infertility. Abnormal periods are pretty typical. And it is basically, you know, there's too much mutated estrogen in the body. And the liver is heavily involved. It's usually the liver and the uterus. And maybe Dr. Mary can go into a little bit about the liver and its role in endometriosis.
Well, there's so many different things. One is they now know that part of the reason why women have endometriosis is a lack of vitamin E, and it's the liver that produces vitamin E out of soy and out of wheat products. So that's one connection. The other connection is the dominance. Whenever during the woman's cycle, different times the estrogen is dominant, and then the liver should pull out those estrogens, and then the progesterone becomes dominant, and it pulls out the progesterone. That perfect balance of harmony between the two as they switch places is solely the liver's responsibility. So if the liver is weak, it can't do that. Then, as you said, if there's mutated estrogen, the body uses estrogen to do something like put calcium in the bones. That estrogen has been used, it goes through the liver. The liver decides whether it can be reused, recycled, or it should be dumped. And a weak liver lets the estrogen that should be dumped back into the bloodstream.
That's not a good scenario.
It's not.
No. So my top suggestion is to take increasing amounts of liver cleanse formula, and that helps tremendously. Also, indole 3-carbinol helps to block the mutated estrogen. I also suggest that you rotate evening primrose oil, super omega-3, and flax oil. One day you take one, the next day you take the other, and the next day you take the other. Vitamin E, always take your oils with a protein. Always, always, always. Vitamin E and vitamin C are also very important. I've got the dosages listed on my website on this page here, so you can take a look at that. And skeletal strength rate help balance pH. A lot of health conditions that occur in the body are because of an imbalanced pH.
It also helps the integrity of the tissue, so that is helpful.
Say that again?
Calcium, magnesium helps with integrity of tissue.
Oh, okay.
So that's important. What were your symptoms, Tara, whenever you had endometriosis?
You know, I was just in excruciating pain, specifically with my period. It would just, I couldn't get out of bed. Sometimes, definitely for a full day, sometimes it was 2 days. And I would have intermittent pain during the month. I never knew why. I always had very much pain at the time of ovulation on day 14 days after the first day of my period. And, you know, the condition was just getting worse. My doctor kept telling me that I wasn't going to be able to have children if I didn't do something about it. I'd had 2 surgeries, and I wasn't married, and, you know, he kept telling me I needed to have a baby, and I didn't believe in, you know, doing that. So he just kept telling me, you're never going to be able to have children if you don't do something now. And I didn't do something. I didn't, you know, decide to have a baby. I got married just before I turned 30. But before that, I had learned so much about natural health and how to help my body. And by the time we got married, my cycles were doing better. They weren't perfect. It took me about 6 months to conceive my first. which seemed like an eternity because my doctor kept telling me I wasn't going to be able to have children. So each month that went by, I was thinking, maybe he was right. Maybe I really never will have children. So my heart goes out to you folks who've gone far longer than those initial 6 months that I went through, because I know it's each month is a bit of a torture, and so that's basically why I'm putting this website up, is to help you folks to share the knowledge that I've learned over the years and help you learn some of that so you can employ the things that I did. Another great thing to do is to use castor oil packs over the liver and over the uterus, alternating. So what I suggest is do 3 days over the uterus and then 3 days over the liver, and just alternate like that. And it really helps to keep the liver clean and the uterus clean. That's only the first part of it, though. We need to bring nutrients to the liver, and we need to bring nutrients to the uterus. And with my suggestions here on my website, I make those, I tell you what my suggestions are to do those two things. So anyway, we're going to try to keep it short so we don't, so we don't bore you, and you can keep coming back and watching our short little videos. Is there anything else you have to say, Mary?
Basically, for those who are maybe given up on having children or think that this is just a short-time problem, the endometriosis can escape the uterus and even strangulate the bowel. So there's a lot of reasons. Some women might say, well, I just can't get rid of it, I'll just have to not have children. But the damage of letting endometriosis go rampant can be far-reaching and long-lasting.
That's very true. And a suggestion that I often forget to make, because it's so just should be definitely a part of this, is to make sure that your diet is really good. I always suggest to go on a paleo, or if you have any autoimmune issues, to go on an autoimmune paleo. It's very difficult to do, but it is so worth it because you feel so good, and it's amazing what life feels like without any pain and suffering. So make sure you get 60% of your diet is raw vegetables and 20% of it is raw fruits, and make sure you get healthy proteins and oils with very few carbs. But visit Whole30, I believe it's Whole30.com, and they have a whole lot of different suggestions. Google paleo, look it up, and learn about it, and I'm telling you, it makes a world of difference.
So no more pain?
No, I haven't had pain in many, many years. I'm 48 years old now, and I haven't had pain probably in 15 years.
And your youngest child is how old?
My youngest is 4. So, yeah. So it's good health pays. It sure does. Eating healthy and taking the proper supplements pay. So, okay, well, I think that's it for this evening. Do you have anything else, Dr. Mary?
Nope. Just people keep looking forward. We're going to do a lot of these little spots. And as they say, a picture's worth 1,000 words, and then if you talk with it, it's worth even more.
Thanks for joining us tonight. Good night.
Good night, everybody.